discussion yesterday, we're such a small group that we're able to be very active about the whole discourse that we did yesterday. We have 6 volunteers who are assigned and working with disability, and we have 7 partner organizations that are participating. And some of them were not able to make it yesterday, but most of them were here. So what I'm going to do is present the testing statements, just so you have an idea of what the discussion was all about, and then after that, a few highlights of the discussion. It's also helpful to say that the program area plan for disability has 3 objectives. The first one is we do advocate for the Filipino Sign Language, most especially in the national capital region, that's in Manila. The second one is we work with we'd like to increase capacity building of partner organizations. We originally target capacity building in relation to advocacy, but it has expanded beyond that. It has become more technical skills such as organizational development, finance management, and the other work that the volunteers are doing. The third objective is to work with disability mainstreaming and gender mainstreaming. Okay, so 3 objectives that the FAR covered. Okay, the testing hypothesis. We had 7, and this is the first one. National PWD stands for People with Disability. Organization should influence national television networks in advocating for television sign interpreting or television captioning for the benefit of the deaf sector. For people who have televisions at home, you would notice that there's not much happening in this with this kind of activity. Okay. The second one is National PWD Organization should influence the Department of Education in inclusive education for all PWDs, and that's mobile challenge, visually impaired, hearing impaired, slow learning disability. The third one talks about VSO should work closely with ORA. ORA stands for Organizations Rehabilitation Associations, which is an umbrella organization here in Cebu where a majority of the volunteers are assigned. Partners have not maximized targeting the local government unit for fund allocation. And then accreditation with necessary institutions are generally ignored by partners, thereby losing opportunities for practical development and funding. Plating disability mainstreaming into concrete terms that ordinary people can understand is easy. And then focus work in national volunteering on volunteer involving groups in the following areas: advocacy, marketing, resource mobilization, project development, and management. Again, we do acknowledge we need to break this down more detail. So those are the 7 statements. The way we did it is we had 4 categories. On the floor was a tape that says agree, strongly agree, disagree, strongly disagree. And we asked the participants to stand where they feel in reaction to the statement. We do acknowledge that by the Magna Carta for the persons with disability, there's such a thing as the 1% allocation from the IRA. We're presenting this also because we have in the audience several local government units. And as the partners have said, continuously this has been very difficult to access. The 1% is even divided for PWDs and senior citizens. So that's 0.5. But that's in the law that says they have access to that fund. But in the review, the group also realized that several of the organizations, especially Disability People's Organization, the community-based people's organization, which majority of the disability groups are not, they see the gap of also knowing how the system works and to be able to access that information. We continuously want to talk about mainstreaming because we see this as very important, and if we can embed, as they say, strategies in the work of the other program areas, secure livelihood and peace building. if there's such a thing as succession training, this is something that VSO can assist or hopefully bring in some skills. There's a lack of leaders. Current leaders have identified that they need to pass on the baton to the next level. Okay. And we'd like to leave the local government units with a question as what do we need to know to be able to access, especially the discussion on the first item. What do we need to know as DPOs? These are disability DPOs, are very local based organizations to know to be able to access the funds.